It's no secret that as we get older, we need to make accommodations in our life to respect the fact that we are getting older. We all know the basic stuff, getting a little bit of exercise, eating right, and certainly getting enough rest. But a lot of us are leaving out a couple of really important things sometimes, and that includes getting a physical and getting an eye exam. Joining me now is Bonnie Taub-Dix. She's a registered dietitian and also a lifestyle expert. Bonnie, thanks for being with us today.
Hey, George. Thank you for having me.
What are some of the accommodations that we all need to make as we get older?
You know, as a dietitian, I have spent my career guiding people about how to make healthy food choices. And I find that it's just the little tweaks that they make, the small steps that actually could make a big difference, like taking the stairs or drinking more water. And also one of the easiest things that you could do is to have a comprehensive annual eye exam. A lot of people think that just because they have good vision or because they have good health, that means that they have healthy eyes. But actually, that's not necessarily the case. And by getting an annual exam, you actually could be doing something that's life-saving.
It's been said that our eyes are a window into everything else. How can getting an annual eye exam tell us more about our overall health?
Well, surprisingly, an eye exam can actually detect the signs of chronic disease, like high blood pressure or high cholesterol or diabetes. I mean, I don't know how you could not get an eye exam because it is the easiest way to take care of your health.
And a recent Harvard study pointed out that a lot of us are not getting these eye exams and these physicals, particularly during the pandemic. How can we make getting these things simple and attainable?
Yes, the pandemic has changed us in so many ways. But you know, with VSP individual vision plans, you could actually have access to eye care in an affordable, easy way, and you could customize it to meet your own needs. A lot of people don't realize that when they have Medicare, that eye care is actually not covered. And I had to learn this in my own way. When I was taking care of my mom, I was so surprised to see that she didn't have eye care included. So it was actually very expensive and very difficult to find a qualified healthcare professional. It was expensive for her glasses and also to get an eye exam. I mean, I wish I knew that VSP existed back then.
And that's not a term I had heard before. How do VSP vision plans work?
Oh, it is so easy. All you have to do is go to vspandme.com, or you could use your phone's camera and click the QR code. The day that you sign up for a plan is the day that your benefits begin. The great news is that it's likely that your trusted eye doctor is already on their plan because VSP has the largest network of eye doctors in the country. But if you'd like to try a new doctor, you could also sign up for a new local doctor. But also, if you are on Medicare, you can still use your Medicare benefits and then have VSP as your complementary care. So unlike my mom had to deal with, you could be sure that getting an annual eye exam would be part of your care.
So how does it work if somebody else in your family needs coverage?
Well, that's what makes VSP so unique. You could get coverage for yourself, and at an additional savings, you could add on a family member. Plans start as low as $13 a month, and that includes a generous frame allowance. When I think about VSP, I think of three things. I think of flexibility, convenience, and reliability.
Well, you pay less and you get great coverage. So where can we go for more information about this, Bonnie?
To learn more about our plans, just go to vspandme.com or scan the QR code that's on the screen. And honestly, I don't know how you could not get an eye exam because it's one of the easiest ways that you could protect your health this year.
Bonnie, that's news you can use. Thanks so much for being with us today.
Thank you for having me.